Yes, hello everyone, and welcome to our Nurse Founder Forum live chat. Healthcare professionals are some of the most overworked people in the world, yet many still struggle financially, emotionally, or professionally. And tonight we're talking about how to change that, how you could have your own virtual assistants. But before anything else, we would like to welcome you that this is our Nurse Founder Forum Tuesday live chat series. This is a growing community built for nurses and allied healthcare entrepreneurs, healthcare leaders, and businesses serving the healthcare industry. I'm Christopher Waikoko. I'm the chairman for the Nurse Founder Forum. Whether you are burnt out from the healthcare system, looking to start or scale up your business, wanting to connect with healthcare decision makers, or serving the healthcare industry through your product or services, you are in the right room. Join us as we are bringing together the founders, healthcare professionals, executives, and industry experts to discuss leadership, entrepreneurship, mental wellness, AI, business growth, staffing, healthcare innovations, government contracts, and more. Just connect, learn, and be inspired. Now, if you're interested to know more about the first ever Nurse Founder Forum live here in Dallas, or it's going to be in person, please, whether you want to start your business or you want to tap our private exclusive group, type forum at 956-425-9926. Again, it's 956-425-9926. All right, there's a lot of intro. So without further ado, we would like to invite our expert. He's our current chairman for the Philippine American Chamber of Commerce, DFW. Also, he's the CEO of Angle Marketing and Virtual X to talk about the virtual assistants in healthcare. Let's give it up to Mr. Robert Raroque.
Hello, good evening, everyone. How are you all?
Yeah, I know. We are live, and then if you guys are watching, and just type what profession you are and type the state or city where you are. We're going to check all the messages. Feel free to type on the comment section, and please like, share our live chat. Kuya, how are you doing?
I'm good, thank you.
Mm-hmm.
So
Yeah,
weather is pretty good outside.
right. The weather. That's why we rain or shine, and the weather here in Dallas is on and off. So that's why. But still, we're providing this continuous education. So we would like to start to get to know you more personally and also professionally. How did you start before having your own company, Kuya?
I started with basically establishing a medical transcription operation
Mm-hmm.
20 years ago, and then from there, when electronic medical records started getting more popular in 2010s, then the physical charts
Mm-hmm.
became electronic. So now it became possible to outsource some of that information. And then from there, it grew. And then the next part is when COVID happened, then the demand for remote
Mm-hmm.
services grew as well. So at the same time, it also created a lot of difficulty, challenges, and
Mm-hmm.
frustrations for a lot of healthcare business owners. So
Yeah.
they needed help as well.
Yeah, what are the most common frustrations of, especially in the doctors' clinics and the clinical settings that were able to resolve or you were able to help with?
Oh, one of the biggest deal is when we started having electronic charts.
Mm-hmm.
Therefore, if you don't have a scribe and you are there with the patient, then after each encounter with patients, you still have to take notes after. Then you still have to do dictations after and put it all together. Sometimes you'll be working until 8 or 9 at night if you're a doctor, for example. So that's
Mm-hmm.
one challenge. And then second is there are a lot more requirements.
Mm-hmm.
So you'll find out that the actual patient care becomes a smaller component of the actual care ecosystem. And so there's a lot of admin, appeals, submissions, claims, checking
Yeah, and
validation.
right, and there's so many
So
paperworks, right?
There's a lot of paperwork, a lot of paperwork, a lot
Mm-hmm.
of processes. So once upon a time, you see the doctor, you're given a prescription, you get some checks, then you go home with the prescriptions.
Mm-hmm.
But that was a long time ago.
Do we have that? As far as I remember, have we always have virtual assistants ever since?
Once upon a time, when the charts were all paper charts, we
Mm-hmm.
can't have remote assistants, because you have to be physically in the office to do what you have to do.
Right. And then also another problem that we're experiencing is the fast turnover. Like here, especially in Texas, when you train somebody today, they will be gone tomorrow, and that's just eating so much of the time. And then time is money, and it's losing the momentum for clinics, especially if they start up training somebody. It's already a full time job, and then the next day you will realize you would they would be gone. So that's one big problem. I also experienced that, Kuya. And then how
Yeah,
long have you
that's
been?
that.
Yeah, go ahead, go ahead.
Yes.
Mm-hmm.
Yeah, retention has been one of the bigger challenges as well,
Mm-hmm.
because you can't afford to a lot of practices now because of reimbursements. They can't afford to put a lot of money in the payroll.
Mm-hmm.
I mean, we have to make sure to be fair to
Yeah.
everyone, obviously, but a lot of doctors have decided to become hospitalists,
Mm-hmm.
because they realized they'd earn more by being hospitalists than by being practice owners.
Oh, being hospitalist. What's the difference, Kuya?
Hospitals here, you basically you work in the hospital,
Mm-hmm.
you're an employee of the hospital, and of course you're still you practice your license and you do the same thing in terms of caring for patients, taking care. But you do not, you don't have to worry about paying the
Employee.
lease. You don't have to worry about paying the bills and the employees and submitting, all the other requirements that you have to submit.
Yeah, and also like there are just so many federal taxes, so that's why that's another one, right? You're whenever you have a local employee, you're supposed to pay different social security, medical
Yeah,
taxes. There's also unemployment compensation. That's really the main cost actually.
that's
Having
that's a compliance.
Yeah, because that's what we are doing whenever we do their tax return. Maybe 55 or 70% of their costs are manpower, especially in the service industry.
Yeah, if you're a hospitalist, if you're an employee,
Mm-hmm.
at the end of your shift, you go home and you're free. You
Mm-hmm.
don't have to do follow-ups on the charts and approve the prescriptions and do dictation. So it's they'll find it easier. Basically, that's a tendency we're seeing quite often. But we do want to support. At the end of the day, it's really between the patient and the
Yeah.
doctor, and the less things we build around that relationship,
Mm-hmm.
I think the more efficient it's going to be.
And then so you did the medical billing. You're still doing the medical billing, right?
Yeah, there's a lot of medical billing providers,
Mm-hmm.
but let's say, um, a lot of practice, they want to control the revenue cycle management, they want to control the medical
Yeah.
billing. So quite often it's more of the medical billing submissions and then appeals,
Mm-hmm.
and then the scrubbing and those things that go with billing.
Mm-hmm. So with this medical billing, of course, we're gonna cover some of the privacy, the HIPAA. How do you guys pre-qualify the medical billers online or virtual? Do they have some sort of certification they have to go through?
Generally, there's medical billing. Part of that's try to being able to understand the charts and to find justification for coding.
Mm-hmm.
The second is coding, and the third is actually getting know how to submit, to batch, and to scrub.
Mm-hmm.
They could be a bit technical, it's an organization, but yeah, to certification, say certified professional coder (CPC)
CPC,
would be really
which
really
is
good.
stands CPC for our viewers stands for Kuya. CPC means
Certified professional coder.
and then the Philippines also, I believe that they provide that certification in the Philippines. Or
Yeah, usually once you get certified, you get a CPCA. I
Mhm.
think for app. Not sure that A stands
Yeah.
for. and there's certain requirements you have to fulfill before they remove that A and you become a full
Mm-hmm.
CPC.
So in a typical startup, do they need, for example, the revenue is less than $250,000? Because we have clients like nurse practitioners. It's a standalone, like do it yourself. They don't have subordinates. They're the one doing everything. How many medical billers that typically in less than 250,000, maybe 100 to 250,000 in a year?
Oh gosh, that's I don't think need a lot in that case, because another factor is how well do you automate it. Um,
Mm,
there are subscriptions, ambience. There are things that would make the scrubbing, make things easier and faster when you batch things. So it would probably differ. The other thing also, revenue is a function of, are you mostly evaluation and management
mm,
consultation,
mm-hmm,
because the bills are small. But if once you have processes, then let's say you have outpatient procedures,
mm-hmm,
then that it doesn't take a lot of procedures to increase that revenue. So that 250 depends on the mix
mm-hmm.
also of the consultations versus procedures, for
Yeah, so
example.
depends on the nature, whether it's like the day to day, the process, or maybe a lot of them are more evaluation and consultation. So depending on the type, right, that they're providing,
Yes,
and then
yes.
you can offer this service all over the U.S., right?
Um, the medical side, no.
Mm-hmm. Oh, okay.
But the support,
Mm-hmm.
at the end of the day, virtual assistants, it's really about processing
Mm-hmm.
information. It's not really decision. They don't really make decisions generally. They might terms of, if there's a protocol that they should assign this to this
Right.
person, assign this to this person,
Mm-hmm.
assign that. But it's more of administrative.
Administrative. And then typically the turnaround time, because I know we have to build the Medicare, or there's a turnaround time that those need to be submitted, right?
Are you talking about in terms of starting a practice and
For,
building a
yeah,
team?
for billing. So for example,
For
you have to
billing,
bill in certain days or time, right? I think it's 40, I don't know,
yeah.
48 hours.
Um, I have to look at that what the basic deadlines are. But the sooner you build, the sooner you get paid,
Yeah,
and time is money.
true.
So, but at the same time, you have to build correctly
Mm-hmm.
to make sure you get approvals
And what do we need
to get paid.
have
I
to
mean,
require also like a physical person aside from the doctor? It's also required to have somebody in person, like the receptionist, right? We cannot delegate everything.
absolutely yes.
Yeah, even just one person as a in the receptionist.
Yeah, let's say for evaluation management consultations, there could be about 20 steps in the process.
Mm-hmm.
Three or four would have you have to be has to be physical.
Mm-hmm.
You're right. Reception, the waiting
Yeah.
room, um, guiding people in, taking the vitals,
Mm-hmm.
initial interview with the patient. So this will have to be physical,
Yeah.
obviously, and maybe some basic tests with the patient, non-invasive tests, for example,
Mm-hmm.
or behavioral or whatever. So you'll still need, depending on your load, you'll still need to have somebody on site, and then including especially taking the
Mm-hmm.
vitals.
Yeah, the talking about the functions and the delegations. What are the things that you can delegate to virtual assistants and cannot delegate?
Okay. The principle in terms of delegations, at the end of the day, if it's information basic processing based on a procedure and a protocol,
Mm-hmm.
um, you would require specific skill. Then, for example, coding, if they are certified, that means they pass certain
Mm-hmm.
standards, and there's a big chance their coding is going to be not accurate. Again, the coding follows the
Right.
treatment, and obviously not the other way around. And the treatment decisions are always made by a licensed
Mm-hmm.
professional. So, what can be done in terms of, let's say, you can do, let's say, insurance
Mm-hmm.
verification, prior
Yeah.
authorization, referral scheduling, back office. In terms of revenue cycle management, you mentioned billing. You can have appeals, collection, follow ups. and all those things can be done. You can also have an executive assistant in the office for the non-medical part of the business. Of course, you have facility management. You have to pay the electrical bills, the internet,
Yeah.
hazardous waste disposal, and a lot of other things. And that you might need, you know, a doctor might be or a professional might be too expensive for some of these things.
Yeah, especially I think on the get-go, I think because doctors work on holidays, weekends, I think having an executive assistant, we're not just talking about medical related, but having an executive assistant, for me, I think that would be the first one. So at least that would be the one binding together the different functions from accounting, like as you said, that bills, also those marketing operations. So those are the things that an executive assistant, if we're going to go to you, Kuya, the first thing.
Credentialing, continuing medical education coordination,
Yeah.
a lot of these things are basically can be considered administrative.
And that
There's even social media engagement management.
management. Mhm.
That might be another thing that an executive assistant can help
Mhm.
with.
And that's we just want to say shout out to Jane, and they're watching. CJ Hicks, thank you guys for tuning in. Please click share and subscribe on our channel, on Nurse Founder Forum. And Des, the Des, she's also watching. There you go. So if you guys
Hello.
need more services, we have the contact information on the screen. And then also, Kuya, since we're halfway, we would like to invite everyone again. This is our first ever healthcare. We have a healthcare founder mixers on May 21. We are bringing exclusive mixers for healthcare professionals that would like to be entrepreneurs. So this is not your typical networking event. This is about building strategic relationships, collaborations, referrals, and opportunities inside healthcare. And also, Kuya, on July 25, this is a whole day event, the
Mhm.
first ever, first Nurse Founder Forum and Allied Healthcare Entrepreneurs event. So we have powerful experience featuring expert panels, leadership and business education, high level networking, healthcare innovation, entrepreneur and industry insights. So, if you ever felt burnout and stuck professionally, wanting something bigger outside the traditional healthcare path, or if your company serves in the healthcare industry, you need to be in this room. Text forum at 956 425 9926 for event information, sponsorships, partnerships, and VIP opportunities. Well, yeah, it's going burnout. We're talking about burnout. Yeah, that's even
Yeah.
HR. As like me, I never really have an HR. I like me, I don't do HR. And what are the different virtual assistants you provide? So we discuss executive assistants, but now the company is growing. It's making 500,000 to 2.3 million. What are the other basic virtual assistants that you guys provide?
For are you talking about
Yes, for
non-medical or
non-medical.
purely
Yeah,
the
it could be
medical?
both. But for example, it could be medical this one and non-medical this one.
Okay, there are this in terms of helping with let's say first the
Mm-hmm.
medical. We talked about those involved with revenue cycle management, insurance
Mm-hmm.
checking. There's front office who can do scheduling, referral, and scheduling. Who can take the phones because now the phones can now it's easy. It can be channeled as
Right.
well. And then, of course, you can have. We talked about executive
Mm-hmm.
assistants, but there's some tough things like fax monitoring, which can be a boring job, but it's very, very
Uh,
important.
what is fax
Um,
monitoring?
um,
Are you talking about physical or the virtual fax now?
it's not becoming virtual in the sense that fax is still being used a lot, used heavily as a way of transmitting information. Because whenever there's a referral,
Mm-hmm.
something takes more than one doctor, physician, specialist to take care when a patient needs treatment management or help. And so therefore they have to transfer patient information within each other. Let's say you're referred, then the family practice, a primary care
Mm-hmm.
provider will send your medical records to another doctor, and fax would still be one of the ways of doing that. But when they come in, generally being able to sort that can be and double check could be a manual process.
Right.
So there are ways. In fact, AI could be starting to come in to do some of those as well. However, the last touch might have to be a human in the
Yeah,
loop
I'm not sure about
because these things are
the
so important.
accuracy of the AI so far. It's still like a hit or miss, right? Especially in because one thing that's very specialized is medical. That it's not something that it will take time. But I also want to remind everybody that AI supplements. It does not really completely replace, especially in healthcare industry, right, Kuya?
Yes, yes. And if you're an AI provider, be very careful with what you promise
Mm-hmm.
because um, you can get in trouble if you
Mm-hmm.
overpromise what you can deliver. Just a word of caution. However, it certainly is making inroads. So you just have to make decisions on where it comes. For example, scribing
Mm-hmm.
that's when it's physically or remotely, whatever the doctor says gets transcribed.
Yes.
So, but AI, for example, can do ambient documentation or
Mm-hmm.
scribing, for example, equivalent, because one could be more reliable in terms of because it's typing fast. It's just
Mm-hmm.
typing, and it's also very easy. It'll just take a few seconds for professional to make sure that the scribing is
Mm-hmm.
done. And but that's a big
Mm-hmm.
deal. It lessens the need for the medical professional, the physician, to have to go back
Mm-hmm.
to each visit. I mean, if you have 15 or more patients in the day for consultation, you have to go back to each one after that and to take notes because you don't want to take all those notes while talking to the patient.
Exactly.
But if you don't do that, you have to spend so much time after. So if you work, go 8 hours, then you have done another couple of hours to make sure the documentation is
We even
complete.
have a therapy company that they also had a lot of this one transcribing, and that's why we went over the basic virtual assistant, guys. For those of you just tuning in, please type what profession are you in, or and even the states you are. We're just gonna give you a shout out. And then also like the basic virtual assistant, we discussed about that medical billing, transcription. Uh, that's something you can delegate in a medical job, but the just remember, guys, you cannot delegate even especially when I used to work in the ER and OR, because there's so many certified nursing attendants there that have been there, kuya, for 35 years. They're the one writing the the like they start the intravenous fluid, D5LR. Those are the things you cannot do, even though your VA is been with you for 20 plus years, right? You cannot
Yeah, you have to
yeah,
be.
they cannot do patient care and clinical judgments, no matter how familiar you
Oh,
guys
no, no, you
together.
can't. Yeah, you need, licensed professionals they get license certifications for a reason,
That's
and
compliant
that's going to
for
stay that way.
HIPAA.
However, you'll find that a big chunk of the work would not require that license and could be administrative,
Mm-hmm.
basically.
Then also the final approval of medical records or changes, it needs to still be a licensed physician who needs to do that and approve. That's why. So aside from Kuya's medical, we discussed about that function from medical billing and transcription. You also offer executive assistant, marketing, right?
Yeah. There's a need, for example, let's say if you're regardless of the industry you're at, you're starting, some you need a mini me, somebody to help you do things, which would might not be worth your time because let's say if you're building something, you want to spend your time interacting more with your customers or your
Mm-hmm.
patients or your colleagues or your employees. Human interaction is and however, if you're so busy, checking the emails, checking the faxes, filling in the forms, it lessens your time. So they say that if things that you can delegate, so that you can better use your time, that would be one. The next challenge, of course, is let's say into sales, and you can't go up because all the again administrative, the social media. So that's one. The next is social media
Mm-hmm.
management and basically to check that. And it's an evolving thing right now. More and more tools are coming up for social media, graphics, video design. But at the same time, quite often you have to still work with the strategies because you need a strategy when you do
Yeah,
that.
even the website,
And then
right?
that's another
Yeah,
thing.
the website also need to be updated. Make sure that all the informations there are still updated. The address,
Yeah,
if
that's
you,
still current.
yeah,
Yes.
that's another thing. I actually get the HR. Do you provide HR assistant?
Yeah, as well.
Mm-hmm.
So HR could have multiple roles, no?
Mm-hmm.
And basically that include um, coordinating, recruitment, putting the science, and maybe initial interview.
Onboarding.
Um, One thing, for example, however, let's say if you're the owner or then you'll probably want to still do the final interview, and the final decision will always be yours
Exactly. Yeah.
at the end of
It's
the day.
that's why
So,
executive.
however,
Mm-hmm.
yeah, but it's going to be a funnel. If you want to have good people, you want to have a bigger pool of people to choose
Mm-hmm.
from. But you don't have time to do that. For example, if let's say you end up hiring, 10% of those who applied, or 5% who applied, that means if you'll hire
Mm-hmm.
one, then you'll have to look through 10 to 20 resumes, maybe interview three,
Mm-hmm.
and then the final interview of
Mm-hmm.
one. But if making that ad, doing the initial interview, verifying the resumes can be done by another service, it becomes easier for you. Then you can have bigger chance of getting quality people. Because if you're rushing and you're busy, then the chance of getting then you might miss some really good
Yes.
people. And at the end of the day, people resources are golden. They're those are going to carry you and carry your business
Mm-hmm.
and carry your customers.
Mm-hmm.
So you have to make sure you have enough attention to getting the right people.
Yes, as we,
But if you're busy, then you're also in a hurry. Then you just hire whoever. Nothing wrong. I mean, I'm not saying people are good, but it's you can have really good people, but it might be a square peg in a round
yes,
hole.
actually the even the IT assistant, those kind of other tasks, even like I also have paralegal, right? Because I because I want those contract to be double checked by somebody. And in your on your company, Kuya, do you provide a full time, or you there also have an option to do a part time virtual assistant?
Part time, it's both. On part time, however, I would recommend no less than 2 hours a day
Mm.
to be
Okay,
meaningful.
less than 2 hours,
It's less
guys.
than that. You don't get you hardly you don't get a lot of benefits less than that. Less than 2 hours a day in general.
Yeah,
And but full time, the nice about full time is that you um, they're there during the same time that you are, because they'll adjust in your time.
mm-hmm.
So availability is very important, because maybe at 3 in the afternoon you think of something, you have to talk, you have got something done. Maybe then at 5 you have to do that again, and maybe something at 10 in the morning. If you have a full time assistant,
Mm-hmm.
they're
Yeah.
there and they can get it done right away.
Yeah, Kuya. And then also, I think another way to do it, well, I believe that another way, if you're both, like there's two doctors, let's say as a startup, they can actually have one, right? Is that possible, Kuya? Let's say one will have 20 hours, the other one is 20 hours is in a week. Would that be possible, like they're working on the budget at the beginning?
Yeah, you can do that. Actually, that's you can break it up as you wish.
Mm-hmm.
And I mean, talking about that 20 per doctor, but it's the same assistant, you
Yeah,
mean,
like one assistant for
or the
two.
other way
No,
around?
no, it's actually one VA for two for two doctors here in the US. It's not really doctor, but the way I did it before, and instead of like my friend that has a marketing company has his own VA, and then I have my own VA, which is both part time. Since they have the same function as executive assistant, we just merge we just have one executive assistant that render 20 hours to me, 20 hours to my friend. And because we also work together, so that's why that's also one recommendation, right, that I would suggest with others that are still working on their budget but also want to be working smart than hard, at least, right, until you get to your budget goes, that you have more budget for the virtual assistant. That's the time you can get a full time.
Yeah, and actually that's a very good idea to do that. Two reasons. Number one is, if it's 4 hours and that it's the 4 hours is the morning, therefore in the afternoon you have to wait till the next day.
Mm-hmm.
But if you have that assistant that you share for the whole day, it gives you more flexibility. In other words, it doesn't have to be the morning is one, afternoon is the other.
Mm-hmm.
It could be for the full 8 hours. The assistant can divide their
Mm-hmm.
time. Number one, so they become more
Yes.
accessible. Number two, it can balance things. For example, maybe on Monday, one doctor is very, very
Mm-hmm.
busy, and therefore does not need might not have time to give assignments, but the other could be needs a lot of help. Then they could sort of balance also.
Mm-hmm.
So that's the advantage of having that sharing
Mm-hmm.
assistance.
And in terms of, I bump into this in terms of holidays. Are we following the Philippine holiday or both holidays?
Yeah, it's a client holiday at the end of
It's
the
a
day.
client.
It's a US holiday.
Mm-hmm.
So at the end of the day, so there are, as you know, let's say the virtual assistants in the Philippines. There's some Christmas, New Year, it's all the same. But we're going to talk about 4th of July versus 12th of June, things like
Mm-hmm.
Thanksgiving, Good Friday's holiday in the Philippines, but not necessarily. But at the end of the day, they adjust.
Mm-hmm.
The other thing's a time difference as well. For example, Christmas Eve is December 24th, 10 a.m., or depending what time zone you're at, in the US. So therefore, it could be that the virtual assistant would still be working on Christmas Eve and New Year's Eve,
Mm-hmm.
because it's not yet New Year's Eve or Christmas Eve in a different time
Yeah, and
zone. But they adjust.
eventually it could it's workable when, like, when my virtual assistant has been with me with the 2 years. They actually were trying to be flexible because a lot of trainings have been provided already in the first 1 year, and that's why we could just uh, compress the schedule for them to take holiday. It's also That's also one way to retain them. It's not just the compensation, but also work flexibility, especially now in the Philippines. But Kuya, I know Philippines. I've heard a lot of good feedbacks. I've saw a lot of my clients really know when they heard my accent, they'd like to get the virtual assistants in the Philippines because these are the most loyal. That's what they said, especially in the CPA world. They are the most loyal employee that they have. They've been there for 10 years and more. So, anyways, Kuya, so we're wrapping this up. Do you have any more few tips for on getting a virtual assistant?
Yeah. Number one, is you what's your vision move? Well, you have to know what you want,
Mm-hmm.
and have to know what you need. And then, if you're not sure, get to talk to people who have experience with virtual assistants, or reach out to me, for example,
Yeah.
and I might give you your thoughts as well on, because you save people, you save admin, you save space, you save in terms of infrastructure, and so therefore all of those things would make things simpler for to run the
Yeah,
business.
so there you go, guys. Simple tips to work smart and not harder with right now with the overwhelming and burnout experience, especially running a business. It's an overwhelming. There's no clock in, clock out. You're always up in the go, but you want to make sure that you're doing things with your due diligence. Importantly, so having, especially if you're doctors, so having another expert that you can rely on to take care of all your admin jobs. So if you guys provide need more information, the website of Kuya Rob is right here. I highly recommend him. I throw him some referrals because
Thank you.
especially shout out to Carol. She respond really fast. That's one thing. Again, guys, we're wrapping up our Nurse Founder Forum live chat for today. Thank you for being part of the Nurse Founder Forum community. Our mission is simple: to connect healthcare professionals, entrepreneurs, and industry leaders through meaningful conversations, strategic partnerships, and opportunities for growth. Remember, you are not alone in your journey. Whether you are building in a healthcare business, exploring entrepreneurships, leading a team, or navigating burnout, there is a community here for you. So again, guys, we have a second mixer for the healthcare founder. If you're in Dallas, join us on May 21 for our second. This is a momentum community mixer for the healthcare founders. And don't miss out our first Nurse Founder Forum and Allied Healthcare Entrepreneurs here in Dallas event on July 25. So if you want to know more, text forum to 956-425-99 to learn more. Ayan. Kuya, thank you so much for being part of our live chat. As always, I really can count on you. And
Thank you for having me, Chris. Thank you, appreciate it. And we fully support the founders forum and the
yeah,
founders
thank you
organization, founders team.
for helping the business here. Thank you also for contributing to provide employment in the Philippines, because that's what we are here to do, is to serve and give more opportunities to our fellow kababayans. And all right, Kuya, stay safe and have a good night.
Stay safe. Good night.
Mhm.